All right, so have you ever wanted to just, like, conquer your fears? Like, really conquer them?
Oh, who hasn't?
Yeah. So you guys sent us this study, right? And honestly, when I first read this, I was like, whoa.
Oh, yeah.
My mind was blown. It's this 1961 study by Dr. Joseph Wolpe
Okay.
on something called systematic desensitization.
Oh, that's fascinating stuff.
It is. Like, it changed how I even think about fear.
Yeah, it's really interesting because Wolpe, he was dealing with what at the time were called neuroses.
Yeah.
Which we would recognize today as anxiety disorders,
Okay.
especially phobias. And his approach was revolutionary because it kind of shifted away from traditional psychoanalysis. Instead of digging into deep-seated childhood trauma, he focused on retraining behavior.
Oh, so it's almost like he found a shortcut.
Yeah.
Like you can just unlearn a phobia?
Exactly.
That's huge.
Yeah, and it boils down to this understanding that phobias, while they can be incredibly debilitating, are learned behaviors. And if you can learn it, you can unlearn it.
Right. Okay, so let's break this down for a second.
Sure.
We all get scared, right?
Right.
But a phobia is like a whole other beast.
Absolutely. Like, have you ever felt like something was just completely dominating your thoughts?
Yeah.
Something that you would go to great lengths to avoid, even if it seemed totally irrational to other people.
Oh, yeah, for sure.
That's the grip a phobia can have on you. It's this irrational fear that's completely blown out of proportion to the actual danger.
Okay, so like if you encounter a rattlesnake while you're out hiking, it's rational to be scared.
Yeah.
But if you're so terrified of snakes that you can't even go to the zoo,
Right.
That's a phobia.
Precisely. And it's not just a mental thing either. The study mentioned some pretty intense physical symptoms that come along with these phobias.
Yeah, it's not just like, oh, I'm a little freaked out. It's like dizziness, heart palpitations, sweating, nausea. It's a full-blown, like, physiological response.
Absolutely.
Yeah.
It can get so severe that it really takes over your life.
Yeah.
You avoid any situation, anything that might trigger the phobia.
Yeah.
It can be incredibly limiting.
And so back in Wolpe's time, kind of the go-to approach for all this was psychoanalysis.
Right. Yeah. Right.
Trying to uncover those, deep-seated unconscious conflicts.
Okay. Now, psychoanalysis is a whole other deep dive.
Oh, yeah.
But essentially, it's based on the idea that a phobia is a symptom of something buried deep in your unconscious mind.
Okay.
Some repressed trauma or an unresolved issue. The thinking was that if you could uncover that root cause, the phobia will vanish.
Okay.
But the problem was it wasn't really working for phobias.
So that's where Wolpe comes in with this totally radical new idea.
Yeah.
He's like, hold on, maybe we don't need to go spelunking in the unconscious.
Right.
What if these phobias are just learned behaviors that we can unlearn?
Exactly. It's like, realizing that you've been wearing your shirt inside out your entire life.
Yeah. Oh, yeah, I like that.
And once you see it, you can't unsee it. Wolpe was saying, let's stop obsessing over the why and focus on changing the what.
The behavior itself?
The behavior itself, yeah.
I mean, he based this off of some fascinating research, too.
Oh, yeah.
He did with animals, right? Like training a rat to not be afraid of a cat.
Yes, that's right. He found that you could reduce fear reactions in animals through a simple conditioning process.
Yeah.
And he gives this great example of a rat that is terrified of a photo of a cat.
Okay.
And so every time he showed the rat this picture, he also gave it food.
Oh, interesting.
Right. And over time, the rat started associating the photo with that positive experience of eating.
Yeah.
And so the fear response diminished.
So he's basically pairing something scary with something enjoyable.
Right.
That's not compatible with fear. It's like, hey, brain, look, nothing bad is happening. In fact, good things are happening.
Exactly.
Oh.
And that's the principle of reciprocal inhibition. It's like, two opposing responses can't exist at the same time. So if you can trigger a response that's incompatible with fear, like relaxation, you can actually inhibit the fear response.
Wow. Okay, so I'm starting to see where this is going.
All right.
But how do you actually apply this to humans?
Right.
That's where the systematic desensitization comes in, right?
Exactly. Yeah.
It sounds kind of complicated.
It's actually pretty straightforward when you break it down. There are basically 3 steps. The first being relaxation training. This is where the person learns techniques to induce a deep state of relaxation whenever they need to.
Okay, so they're like training their body to relax on command.
Right.
So no more like swinging pocket watches and hypnosis like in the old movies.
Yeah, not so much anymore.
Yeah.
Most people can achieve this deep state of relaxation through simple techniques like tensing and releasing different muscle groups.
Okay, so they've got their relaxation skills down.
Right.
So what's next?
Next comes creating what we call an anxiety hierarchy. This is where the therapist and the person work together to create a list of anxiety-provoking situations related to the phobia, starting with the least scary and gradually working up to the most terrifying.
Okay, I'm picturing a ladder in my head.
Okay.
With each rung representing like a different level of fear.
Oh, yeah.
You know, like if you have a fear of heights, the bottom rung might be standing on a chair.
Right.
And then, the top rung is standing on the edge of a skyscraper.
That's a great analogy. The study gives some really good examples of these hierarchies, like for claustrophobia, for example.
Okay.
It might start with, wearing a tight ring on your finger and then end up with being trapped in a small, dark room. So each person's ladder is totally unique to their specific phobia.
Okay, so they got their like relaxation toolkit and then their personalized like fear ladder.
Right.
But then what happens in the actual desensitization process?
Right.
Is this where they have to face their fears head on?
Well, not quite. This is where it gets interesting. So
Yeah.
the person is in this deeply relaxed state.
Okay.
And the therapist starts describing these scenarios from the hierarchy, starting with the one that provokes the least anxiety.
So they're not actually like facing it in real life. It's more visualization.
Exactly.
Yeah.
Vividly imagining the situation while they're relaxed. The idea is to systematically desensitize them to each level of this hierarchy. If they start to feel anxious, they signal.
Okay.
And then the process pauses until they can regain that relaxed state. And then they continue up the ladder.
So they're essentially training their brain to hit the relax button instead of the panic button when faced with their fear.
Exactly.
But did this actually work?
Yeah.
What were the results of Wolpe's research?
Well, the results were pretty remarkable. He treated 68 different phobias in 35 patients.
Okay.
And his success rate was 91%.
91%.
Yeah. So 9 out of 10 people that Wolpe treated were essentially freed from their phobias.
That's incredible. That's like the kind of impact that shifts paradigms in mental health treatment.
Yeah.
And how long did the treatment take on average?
Only about 12 sessions.
12 sessions versus like years of psychoanalysis.
Exactly.
Wow, so it's fast and effective.
Yeah.
But of course there were critics.
Oh, of course.
All right.
Especially from the psychoanalytic camp.
I bet they weren't too thrilled with this new kid on the block.
No, not really.
Yeah.
They argued that Wolpe was only treating the symptoms,
Okay.
not the underlying cause of the phobia. And they worried that new symptoms would just pop up to replace the old ones.
Like a game of whack-a-mole with your mental health.
Perfect analogy.
So did Wolpe have any answers for these criticisms?
Yeah.
Did he just kind of brush them off, or did he address them head on?
Oh, he addressed them. He did follow-up research with his patients for 4 years after the treatment. And guess what? He found absolutely no evidence of symptom substitution or relapse after successful desensitization. The phobia stayed gone.
Oh, wow. So this is starting to sound less like a fad and more like a real breakthrough.
Yeah.
But is systematic desensitization just like a historical curiosity now?
No, not at all.
Or is it still relevant today?
Definitely still relevant. Systematic desensitization is a widely accepted treatment for phobias and other anxiety disorders today.
Yeah.
And there's been, a ton of research since Wolpe's initial study that backs up its effectiveness.
And here's where I think it gets really exciting.
Okay.
There's some fascinating research that builds on Wolpe's work, showing how we can actually use positive emotions to counteract negative ones.
Yes. This idea of reciprocal inhibition is incredibly powerful. There was a study done in 2000 by Barbara Fredrickson.
Okay.
And she explored how cultivating positive emotions like joy, love, contentment can actually inhibit those negative emotions like fear, anger, and sadness.
Wow.
It's like flooding your system with positivity to crowd out the negativity.
So it's not just about like relaxing away from fear, but actively cultivating positive feelings to replace it.
Exactly.
I love that. And this study mentioned another study that looked at math phobia. Now, that's something I think a lot of our listeners can relate to.
Oh, yeah, me too.
I know I can.
Definitely. In 2003, a researcher named Zettel actually used systematic desensitization to treat students with severe math anxiety. And guess what?
It worked.
It worked. They were able to significantly reduce their anxiety and even maintain those improvements over time.
Wow.
It's amazing to see how Wolpe's work from, the 1950s is still having a real impact on people's lives today.
It's pretty remarkable. It's pretty remarkable, really, if you think about it.
Yeah.
Unlearning deeply ingrained fears and actually retraining our brains.
Absolutely.
But how does all of this connect back to, you?
Right.
What does this mean for someone who is struggling with phobia right now?
Well, I think the key takeaway here is that you are not stuck with your automatic fear responses. You can actually rewire them. And Wolpe's research gives us a roadmap for how to do that.
It's like we're not just victims of our emotions.
Right.
We have the power to actually change them.
Absolutely.
This idea of taking something that feels so overwhelming and breaking it down into manageable steps.
Yeah.
It's really empowering, actually.
Yeah, it is. And there's another empowering aspect to this approach too. Wolpe found that systematic desensitization can actually be done with other people present.
Oh, okay.
He actually discovered that having other therapists or trainees observing these sessions didn't interfere with how well the treatment worked.
Oh, so it's a very transparent and collaborative approach. It's not just this mysterious process, happening behind closed doors.
Right.
I can see how that would appeal to a lot of people who might feel uncomfortable with the more private, introspective nature of psychoanalysis.
Absolutely, yeah. And because the process is so structured, therapists can even be interchanged if needed.
Okay.
Which wasn't really possible with psychoanalysis, where the relationship between the therapist and patient was considered really, really central.
Right. Okay, so this is all making a lot of sense to me.
Good.
But let's be honest, the idea of visualizing your fears while you're trying to stay relaxed, it sounds, kind of challenging. How do you actually do that?
Well, that's where the relaxation training comes in. The person needs to be able to access that deep state of calm whenever they need to. And the therapist is there to kind of guide them through it.
Okay.
Starting with that at least anxiety-provoking scenario, working up gradually, a controlled exposure to the fear.
Right.
But in this safe, imagined setting.
But if I'm remembering correctly, the person can always, signal if they start to feel overwhelmed.
Right, exactly. It's a very gradual and controlled process. And, remember, the goal here isn't to eliminate anxiety completely. A little bit of anxiety is normal, even helpful.
Right.
It's about reducing it to a manageable level so it doesn't control your life.
I think a lot of people struggle with that idea, though, we live in this culture that's all about, positive vibes only.
Right.
It's easy to feel like we need to just, suppress or avoid, any negative emotions.
Exactly. And that can be really counterproductive.
Yeah.
When we try to, push those negative emotions down, they often just come back even stronger.
Right.
It's like trying to hold a beach ball underwater.
Yeah, I like that analogy.
Yeah, it takes a lot of energy. And eventually it's going to pop right back up.
So what's the alternative then?
Right.
If we're not supposed to just ignore our anxieties, how do we actually deal with them?
Well, I think it starts with acceptance.
Okay.
It's about allowing ourselves to feel those emotions, even the uncomfortable ones, without judgment. That doesn't mean that we let those emotions control us.
Right.
But we acknowledge them, we learn from them, and we move through them.
That makes a lot of sense. And this is kind of where techniques like systematic desensitization come in, right?
Yeah.
They give us the tools to manage our emotional responses in a healthy way.
Exactly, yeah. It's not about pretending that we don't have fears or anxieties. It's about learning to navigate them in a way that allows us to live these full and meaningful lives.
Okay, so we've talked about how systematic desensitization works, its advantages, and the fact that it's still relevant today.
Yeah.
But I'm curious, how does all this connect to that child with the fear of dogs that was mentioned in the study?
Right. That's a great example of how we kind of intuitively use systematic desensitization in our everyday lives, even without realizing it.
Yeah.
The study suggests that getting the child a puppy might be a way to help them overcome their fear.
Okay, which sounds a little counterintuitive at first.
Yeah.
But I'm starting to see the logic here.
Right. It's about, controlled exposure.
Okay.
Starting with a puppy, which
Yeah.
is generally, less intimidating than an adult dog.
Right.
And because puppies are often associated with these positive emotions,
Yeah.
that playfulness, that unconditional love.
Yeah.
it can help to reframe the child's associations with dogs in general.
It's like creating a new positive association with the thing that they're afraid of.
Right, exactly.
It's not just about like getting over the fear, but like replacing it with something positive. I bet there are a lot of adults who could benefit from a puppy too.
Me too. Well, think about, how we naturally do this as adults.
Mm-hmm.
Let's say you're terrified of public speaking.
Okay.
You're not going to just jump right in and give a TED Talk, are you?
Definitely not.
Right. You might start by practicing your presentation in front of a mirror.
Yeah.
And, with a friend or two, maybe a small group of colleagues. You're gradually increasing your exposure to that feared situation while building your confidence along the way.
So we're all kind of doing like mini versions of systematic desensitization without even realizing it.
Right.
That's actually pretty cool.
It is. And that's what's so empowering about understanding this concept. It gives us a framework for approaching our fears in this deliberate and effective way. We're not just victims of our emotions. Mm-hmm. We have the power to change our responses.
Yeah, and we talked earlier about some of the criticisms of Wolpe's approach, from the psychoanalytic community.
Right.
But his study also highlighted some interesting advantages of systematic desensitization.
Yeah.
And it seems like one of the biggest ones is that like the goals of therapy are much clearer and more defined.
That's a great point. With psychoanalysis, it can feel like you're kind of digging around in the dark, hoping to just stumble upon some hidden truth.
Right.
But with systematic desensitization, the goal is very specific.
Okay.
Eliminate the phobic response.
So it's more targeted and action-oriented.
Yeah.
You're not just trying to like understand your fear.
Right.
You're actively working to change your response to it.
Exactly. And because you're focusing on these observable behaviors, it's much easier to actually track your progress. Mm-hmm. You can literally see the patient moving up that anxiety hierarchy, becoming less and less reactive to those fear triggers.
That must be really empowering, actually, for both the person going through the therapy and the therapist. You can actually see the progress happening right in front of you.
Absolutely. It's tangible evidence that that change is possible.
Mm-hmm.
And I think that's a really important message to get across.
Yeah.
Especially for someone who's been struggling with a phobia for a long time. It can feel so hopeless, like you're trapped.
Yeah.
But systematic desensitization offers a way out.
It's like, hey, you're not broken.
Right.
And you don't have to live like this forever. Yeah.
You can actually change your relationship with fear.
Exactly.
Okay, so we've explored kind of the ins and outs of systematic desensitization.
Right.
But I'm curious to dive a little deeper into that concept of reciprocal inhibition.
Sure.
And its potential applications, beyond just phobias.
Yeah, that's what I find so fascinating about this whole idea. If pairing relaxation with exposure to fear can help us overcome phobias, what if we could apply that same principle to other negative emotions?
Like anger or sadness, even self-doubt.
Exactly. Imagine if we could train ourselves to respond to those feelings with something incompatible, like compassion, joy, self-acceptance. Could we literally rewire our brains to react differently to those challenging emotions?
It's like instead of getting swept away by, a wave of anger, you could learn to just like pause.
Right.
Breathe.
Yeah.
And choose a different response. Exactly. And I think this is where things get really exciting. Wolpe's work with systematic desensitization was groundbreaking.
Yeah.
But it was just the beginning. There is so much potential to explore how these principles can be applied to other areas of our lives.
Yeah, it really makes you wonder, right? Like if we can reprogram our responses to fear, what other possibilities are out there? We've been talking about all this incredible potential of reciprocal inhibition, this idea of using one response to block another.
Right.
But so far we've mostly been focused on, overcoming fear.
Yeah.
But you're suggesting we could apply this to other emotions too, right?
Absolutely, yeah. Think about it. If relaxation can override fear, what could compassion override? What could joy override? The possibilities are pretty fascinating.
Okay, I'm hooked. So let's say someone's listening to this and they're thinking, all right, I'm ready to tackle my fear or my anger or my self-doubt. Where do they even start? Like, what's the first step on this journey of rewiring our emotional responses?
Well, I think awareness is key. The first step is to really pinpoint what you want to change.
Okay.
Like, what emotion is holding you back? Is it a specific fear like we've been talking about, or just something else? anger, sadness, self-criticism.
Ugh.
Once you have a clear understanding of what you're dealing with, then you can start to break it down.
Okay, so we identify the problem emotion, so to speak.
Yeah.
So what's next?
Well, think back to our discussion of systematic desensitization.
Okay.
Remember that anxiety hierarchy?
Yeah.
We can use a similar approach here.
Okay.
Start by identifying situations that trigger that emotion that you want to change, but begin with situations that only cause you mild discomfort. Don't jump right into the deep end.
Right.
As you get more comfortable, then you can gradually work your way up to more challenging situations.
So it's like creating a hierarchy for any emotion,
Right.
not just fear.
Yeah.
So if someone struggles with anger, they might start with, identifying situations that cause just like mild irritation and then work their way up to, situations that trigger full-blown rage.
Exactly. Yeah. And just like with systematic desensitization, you don't have to do this alone. If you're finding it challenging, consider reaching out to a therapist, who can guide you through the process and offer support along the way.
Like having a personal trainer, but for your emotions.
Exactly.
And speaking of trainers, what about those of us who don't necessarily have like full-blown phobias or crippling anger issues,
Right.
but still experience everyday anxieties, like feeling nervous before a big presentation or a first date?
Right.
Could these techniques help with those situations too?
Oh, absolutely, yeah. These techniques aren't just for extreme cases. The principles of relaxation and gradual exposure are applicable to a wide range of situations. It's all about learning to recognize those anxious thoughts and feelings.
Yeah.
And choosing to respond to them in a new way.
So instead of letting anxiety just take over and like send you into a tailspin,
Right.
you can use these techniques to calm your mind and body and approach the situation with more confidence.
Precisely. It's about taking back control. Becoming the master of your emotional experience.
This has been such an eye-opening deep dive.
It has.
We've learned so much about phobias and systematic desensitization and this incredible power of reciprocal inhibition.
Yeah.
Like, it's mind-blowing to think that research from over 60 years ago is still so relevant and impactful today.
Yeah, it really speaks to the enduring power of understanding human behavior and finding ways to help people live happier and healthier lives.
Yeah.
It's like Wolpe handed us a key, and now it's up to us to unlock the full potential of what he discovered.
And that's what's so exciting. This is just the beginning, right?
Absolutely.
Who knows what other applications we might discover for these principles in the years to come.
Exactly. Yeah.
Yeah.
It's a journey of continuous exploration and discovery.
Well, on that note, we want to thank you for joining us on this fascinating exploration of fear and emotions and this amazing potential of the human mind. Yeah. We hope you learned something new and exciting about overcoming your fears and managing your emotions, and that you'll take some of these insights with you as you continue on your own journey of personal growth.
And remember, you have the power to change your relationship with your emotions. Don't let fear or anger or self-doubt hold you back from living the life that you truly desire.
Yeah.
You're capable of so much more than you realize.
Thanks for joining us for this deep dive. We'll see you next time for another adventure in learning and discovery.